Korea's daily tally has been hovering more or less on the 7,000 level, while its number of serious infections stands close to 900. Accordingly, starting on this Monday, tougher prevention guidelines are in place, but health authorities have spoken about the possibility of imposing greater restrictions should the current challenges persist. For more, I have Professor Yoo Byung-wook from Suncheon University. It's a pleasure to see you again, Professor Yoo.
This is my pleasure.
I also have Professor Lee Hoon-sang from Yonsei University live on the line. It's good to see you too, Professor Lee.
Thank you for having me today.
Professor Yoo, we'll start in the studio as always. Let's begin with your thoughts then on the current COVID-19 situation.
Well, some experts in the overseas said diagnosing Korean condition is the word is clueless, someone said. But the point of my view is not, because it can be a natural, spontaneously happening, because the end of the immunities for 6 months past the second shot. At the same time, Korean government decided with the corona relaxing of the social distance, and the cold weather is a triple. The bad thing is coming together. The people are start to forget about seriously the COVID-19. That's why this result comes now. We can have it.
I see. And Professor Yoo, what is your forecast now regarding the current situation for the weeks ahead then?
So I think for the foreseeable time being, because there had been reduced level of the social distancing, and also with the it will take some time for the third dose of the booster dose vaccination rate to increase in the population booster dose vaccination rate. So for the time being, at the current level of the social distancing, and also, even though the government raised the social distancing level, it will take some time for that to have the effect. So for some of the foreseeable time, I think the current trend of the high level of the confirmed case happening will continue.
Do you expect the daily tally, Professor Yi, to perhaps surpass the 10,000 mark in the near future?
At the moment, without any kind of a drastic government policy, especially in the strengthening or heightening of the social distancing level, and also with people keeping current level of gathering and meeting and participating in social activities, it might continue in current level.
I see. So you do believe that tougher restrictions are in order then? We would need them?
I think without that, I think it may not be not so easy to control the current transmission level.
Right. And before we discuss about the perhaps tougher measures then, Professor Yoo, perhaps you could tell us a bit more about what you believe is fueling this latest outbreak here in the country.
Well, in point of a scientist, as a medical doctor, actually there are no evidence in its own Korean data. When we start the relaxing as for social distance, we're catching some data from US and the European countries. They said at least after second shot, so immunity goes more than 6 months and will be more, and we are considered booster will be covered all. Also, Delta variant, it happened in Koreans and other countries, probably passed very mild. But we don't have the exact evidence how we can treat it and handle it, put our policy. So our neighbor country in Japan, so it's ridiculously, there are very less patients confirmed and very less the death rate. So someone said, if there are mild variants, it can be the goes around in Japan. Their own data say they have the fully immune, even they didn't vaccinate it, because around the Olympics game, many people exposed and getting COVID. That's why they got now period of national and the normal natural immunity periods. Probably period will be gone. But unfortunately, Korea is like a window period, weak point. Weak point, we open it. That's why it can be outbreak, like a balloon about to burst out. So unfortunately, so from now on, people, we can get a mistake, but we not do mistake again. So from now on, when we start out with the booster or third shot this moment, we have to get the evidence with the sampling or whatever in the Korean people's the data that will help to prepare for third or the fourth or fifth booster shot in April or March next year.
I see. Professor E, as part of efforts to better contain the situation here in the local front, vaccine pass requirements have been broadened starting on this Monday. Now, how effective does this measure look to be in your view, Professor E?
I think vaccine pass might have effect to a certain extent. But I think the focus, the important focus should be not only on the vaccine pass itself, but what is important will be raising the quickly raising the booster dose vaccination rate, and also even for people above 80 years old. There had been some of the vaccination rate of 80% had been reported. We are just trying to have this vaccine pass to increase the vaccination rate, but also to protect for those people who had not been, who are not protected. So we need more than just using of this vaccine pass.
Right. Professor Yu, health authorities have also shortened the interval between primary and booster shots to 3 months for all those aged 18 and above. Now, having said that, what are your thoughts on the efficacy and safety of additional doses?
Well, first of all, safety matter, I guarantee will be fine because our main concern is anaphylactic shock. Usually the first shot or even the second shot, it can become as like allergic reaction, immediately happen. Sometimes be delayed like a myocarditis, something inflammatory is in heart. It can be delayed, but I believe the safety measure is fine. But my little concern is there are two major principles about the vaccination in the minimum age and the minimum interval. For example, hepatitis B, we need 3 shots. First, second is at least 1 month. Second to third, we need 3 to 4 months. But if we have an opportunity to have a shot short towards the last third one, in the doctor we can say third one it doesn't work. Why? Time is very short. Because the immune system is a little difficult to explain in all, like a B cell memories and the T cell to immediately react it. So probably that's why we recommend, so Pfizer is at least 3 weeks to depart from the first and second, and the other one, the 4 weeks to depart, because it helped to make the enough immunities. So now only UK and Greek and the Korea, the third country, started for 3 months the difference to the shot of time. But we need the evidence, it's working or not. But probably the safety matter is fine, but if it's working good, will be fine. But if it's getting shorter, so the third shot will be not working properly. This is my concern.
I see. Professor E, now, Professor Yu here in the studio has spoken about this a bit earlier. He talked about the possibility of additional shots in the form of a 4th or a 5th booster taking place sometime in the spring. What are your prospects on additional doses following the booster, the 3rd dose?
So I think at this moment we cannot exclude the possibility that we might need the 4th dose or 5th dose thereafter. But at the moment, I think we will have to have more data after this 3rd dose booster dose vaccinations had been rolled out. But at least for those people who are in the immunocompromised situations, the US CDC had been already recommending 4th dose for people with compromised immunity level. So I think we cannot exclude the possibility that maybe sometime next year or in the early next year, maybe we might need 4th dose. But I think before we decide on that, we will need more robust data after the 3rd dose booster vaccinations.
And staying with booster shots, Professor Yu, what are your thoughts on the possibility perhaps of offering booster doses to those aged 12 to 17, later on that is?
Well, for my chance to answer about it, but because the teenagers, so it is a certain group who are a major risk, like asthmatic conditions and who underline the chronic illness, yeah, they have to have a vaccination. I 100% agree that. But before we move that, is recently the end of November, Indonesian government approved the Novavax one. But Korean governments and our health authority process of approval of Novavax, but still be delayed. Before we move to give a shot for our children and adolescents and the teenager, please, if we give them to more opportunity to choose for the Pfizer one or the Novavax one, probably the parents and the students, teenager will be followed because vaccine is not compulsory, it's following our own will. Anyway, third or booster shot for the teenager one, what the Professor Lee, he comments, after the third shot in the ongoing in Korean population this moment, we have to be sure the low data of February, March, and then we can be applied for a teenager safely, and we have to show the efficacy and how it works exactly for our more than 18 years old. And then Korean data will help to show the parents and the teenager to going on to consider a third vaccination.
I see. So we'll have to wait for data from booster doses for those aged 18 and above before we decide on booster doses for those aged 12 to 17.
Correctly.
Professor Lee, what are your thoughts?
So I agree with that. We will need quite robust data. But as soon as we get those data, I think it is highly likely that it might be quite recommendable for those teenagers between 12 to 17 to be vaccinated. But I think what is important is for the government to have very careful and very considerate and very engaging health communications approaches with the students themselves and the parents of those students. Rather than like very compulsive approaches, but very engaging approach with a very considerate communications with those who will be vaccinated and those parents of those teens who will be vaccinated.
Right. And staying with booster doses, Professor Yi, how do you respond to doubts about the efficacy of third doses in light of post-booster infections?
So, I think there had been there can be some of the breakthrough infection even after the third dose, especially with the current Delta and like Omicron variants. But I think what is important is not only the aspect of completely minimizing the possibility of the breakthrough infection, but even though there can be some level of the breakthrough infections, still, the third dose vaccine will reduce the hospitalization rate and reduce the development of severe case and mortality rate. And also, it will be quite helpful for protect against the Omicron variant, which seems to be possible to become a dominant variant. And also, especially, it will be important for people age over 60s and with the underlying conditions for them to avoid any possibility for hospitalization and developing severe case and have a mortality cases. I think third dose will be still very important.
Right. And speaking about the third dose, Professor Yu, as of now, the booster inoculation rate stands at around 13%, 12.4 to be exact here in the country. How does this particular rate compare to those of the first and second inoculations? And what more perhaps could be done to further boost it? Even
this winter season, we are on the crisis. Probably it's a little difficult to make like our second shot because our complete second shot rate is around 80 more %. But I couldn't expect it same as like the second shot for the complete the third one, because the reason why people are still just they are hesitated. Some the news coming said after the second shot of the, for example, Pfizer, only 2 months ago, and the Omicron working against the Omicron only 20 or some %. So they don't convince anymore the vaccination. Also these days, the teenager and parents are a little bit of protest against the government will, because they didn't show any order to the data exactly for the Korean peoples are. But exactly we have to do now, more than 50 or 60 years old, who are passing more than 4 months after the second shot, yes, they need the vaccination, even since the Omicron and other variants doesn't work well. Why? Because the booster one, after the 3-4 months later, anyway, it helped to make our neutralized antibody against any action on the virus. So we have to show the data to who are follows and they believe that. You know what? More than 65 years old peoples, they're annually after 2015, we gave opportunity of free shot for national immunization program for the influenza. Automatically they have it because they believe governments convinced to give the opportunity to have an influenza vaccination and they believe they feel safe. But problem is now Korean people they are front of the agitated because vaccine pass is kind of pressure to have a shot, but the people they feel not so easy and feel safe for the second more than third shot. So please show us we can follow in some of the data or as Korean one. Probably more than 65 years old people, they will follow automatically.
Right, so we need the disclosure of more data with regard to these shots then.
Absolutely.
Professor E, let's go back to something you mentioned earlier. So you have spoken about the need to further toughen COVID-19 prevention efforts. Could you give us some examples of what measures should be taken?
So I think the issue is the difficulty with for small business owners and for the economy, the sustainability issue of the social distancing. But at the moment, at this higher level of the COVID-19 cases developing and with the high number of the mortality cases and severe cases, I think at the moment, until we reach some level of the higher level of the booster, third dose booster vaccination rate, I think for the time being, what we need is a stronger social distancing measure. Mask will be still very important. And especially, I think we need a very stronger measure for reduce the amount of social gathering, maybe less than 4 people, maybe like 10 o'clock curfew and work from home for companies and government agencies. So with this, some stronger measure for at least 1 or 2 weeks until we increase the booster vaccinations. And I think we need somewhat more of the stronger measures to change the situation. And also, as I said again, as for the teenagers, what I think it will be important is not even only for the protecting those teenagers, but even though the severe symptoms does not appear in them, they can be carrying and transmit those COVID-19 to older aged people as well. But to really work with those teenagers for having vaccination of those teenagers between 12 to 19 years old. We need stronger evidence, but also the more stronger engaging health communications and really talking with those people of the students and the parents about the vaccinations. And I think that and more of the stronger assurance about the vaccine safety and a clear communication about the effect of the vaccine.
Right. And Professor Yu, what are your proposals to better tackle this latest outbreak? I understand some health experts have called for, Professor E mentioned a curfew. There are experts, health experts, who've claimed that a curfew of perhaps 6 p.m. is necessary at this point. What are your thoughts?
Well, my idea is 100% agree with Professor Lee. But furthermore, I would like to see the next March, because we're going to have winter vacation soon. School will be closed. So which means that many people is less activities and the less going around the teenager. That's why they can be a reserve, but probably the less opportunities. But the next new semester open, because Korea and Japan in the March is the new year's beginning for the school year compared to others. So which means they're going to mix and get alone as well. So which is can be now we can call 5th wave, but we have to be prepared for the prevention of 6th wave from the March. So how we can handle it? First of all, I 100% agree what Professor Lee mentioned is we kind of the lockdown level of the measure. But you know what? Now we are now just pause, not back to the high, strong level of restriction, because we are under the easy, relaxing social distancing just 4 weeks now. So we need the signal and decision. We have to back to the strong level of this social distance measure, or anyway, because many European countries, still US, they still ongoing easing and relaxing social distance measure. But before the March, we have to take care of, because new school seasons begun, probably under chaos. Some people said now we are facing on because of school open from September, and the 12 weeks later is incubating, mixing. That's why we are facing on the fourth wave now. So before school seasons beginning, we have to be prepared for the vaccine program for children with another option like Novavax. This is what I'm insisting saying. If there are more options for the safe, parents and teenagers will follow the vaccination, and we can catching and prevent the fifth waves.
Professor, you tell us a bit more about your confidence in Novavax.
Why? Because Novavax, this vaccination is very new, but we can call the Novavax vaccination is made the same process like a hepatitis B vaccination. So actually is like a messenger RNA type of vaccination will be increases very rapidly to level, which is level of the neutralized antibody to fight against the virus. But the Novavax one is like hepatitis B, is slowly going up, and the protein subunit recombinant one is we use quite long times, like the virus vector type. So we have a long time experience and we can handle it. So which means even now, Indonesia is the fourth the biggest population countries. They're using the many options because many people, but still shortage of vaccination, they open and use that, and they started vaccinating for young people with the Novavax. So I believe the Korean government now under investigation for the safety measure and will approve that. So we are going to give the vaccination for children and also pregnant women and who want to have the third shot for different type from the messenger RNA, give them two options and they will follow it. Also, not only this protein subunit like the Novavax, if we have a more option, we will follow that, and naturally we get used to, we can overcome COVID-19.
Right, I suppose the availability of more vaccines will boost our protection against COVID-19.
Absolutely.
All right, Professor, as always, thank you very much for your insights. Professor E, thank you very much for your time and your thoughts today.
Thank you for having me.